A warm welcome to everybody. Our topic of discussion today is regarding the mandible. Now again, I had made a video about mandible previously in my channel, but as you can already guess from the title, this is going to be a rapid recall video. So we are going to recall rapidly the entire mandible, and so it will be a little fast. The discussion will be a little fast. And I recommend that you study the mandible a bit, at least a bit, before you watch this discussion, alright? Anyways, so without wasting any further time, let's rapidly revise the mandible. Okay, so this is the mandible. It is the only movable bone in the face. Now, as far as the bony features of the mandible is concerned, the entire mandible is divided into two parts. One is the horseshoe-shaped body and the two rami, which are quadrilateral, right? Now, as we can already see, let's first talk about the body. So as we can already see, the body has two borders. The upper border, which is the alveolar border, which obviously bears the teeth of the lower set, and it also has a lower border, which is forming the base of the mandible. It has two surfaces, the outer external surface and the inner surface, obviously. So let's first talk about the external features of the body of the mandible. The very first external feature that we can appreciate in the body of the mandible is the presence of this midline structure. This midline structure, this is the symphysis menti. The symphysis menti is actually representing the line of fusion of the two halves of the mandible during their ossification. So symphysis menti is actually a fibrocartilaginous structure during the ossification of mandible, but after the ossification is complete, it actually ossifies to form a part of the bony mandible. Below the symphysis menti, we see a triangular protuberance. This is known as the mental protuberance. See, it is very, very appreciable from the lateral aspect. On either side of the mental protuberance, we have two tubercles. These are the mental tubercles. So symphysis menti, mental protuberance, and two mental tubercles. Alright, now let's talk about some other features. Obviously, we can see that there is this hole here. This hole is actually a foramen and is known as the mental foramen. Now, mental foramen, it is actually continuous inside the body of the mandible, and it is forming the mental canal. Alright, and this mental foramen is mostly present at the junction, or rather in between the two premolar teeth. As you can see, these are the two premolar teeth dentation spots. In between them, somewhat in between them, we are seeing the mental foramen over here. Right? This will actually transmit the mental nerve and vessels. Done? Okay. Now, another very interesting thing is, below this mental foramen, we can see the presence of an oblique line, which is running like this and is continuous with the anterior margin of the ramus of the mandible. So this oblique line, this is actually presenting the sites of attachments of some muscles. Anteriorly, this oblique line, this is actually providing attachment to two muscles. What are they? Depressor labii inferioris and the depressor angulioris. These are the two muscles anteriorly attached to the oblique line, and posteriorly we see the attachment of the buccinator muscle. Alright, so these are the three muscles more or less which are attached along the oblique line of the mandible. Now the buccinator, which is attached along the posterior oblique line, this actually encroaches around the third molar tooth towards a raphe, which is known as the pterygomandibular raphe, behind the third molar tooth. Alright, and obviously on either side this is happening. Done? Again, another interesting thing to notice will be the presence of two depressions which are present along the mental protuberance, on either side of the mental protuberance. These depressions, they are known as the incisive fossa. They are known as the incisive fossa because they are located at the level of the incisor teeth. They will actually provide attachment to the mentalis muscle and a slip of the orbicularis oris muscle near the alveolar margin. Alright, so these are the two depressions, over here and over here, incisive fossa. Now let's talk about the other features or the nerves and vessels which are related to the external surface. So what we can actually see is that we talked about the oblique line, right? Now below the oblique line, at the level of the junction of the ramus of the mandible and the body of the mandible, so at somewhat this level, we see the presence or the relation of three structures with the body of the mandible. What are they? They are the facial artery, which is tortuous, the facial vein, and the marginal mandibular branch of the facial nerve. Alright, so they are all related to the lower side of the ramus of the mandible, or lower side of the body of the mandible actually, at somewhat the anterior inferior angle of the masseter muscle. Okay, so they are somewhat related to this part below the oblique line. Done? Done. Now let's very quickly talk about the internal surface of the body of the mandible. So as far as the internal features are concerned, the first thing we can see is that this is somewhat representing the internal surface of the symphysis menti. The first thing that we immediately see is the presence of the spine-like structures. These are known as the genial tubercles. Alright, and there are two pairs of genial tubercles, superior and inferior genial tubercles, or genial tubercles, whatever. So in this model, it's actually not pretty visible. Here it all seems to have merged into one thick spine-like process, but in any normal mandible, in any physiological mandible, you might say, there are the presence of pairs of these spines, right? And these are known as the superiorly located, and inferiorly located, inferior genial tubercles. The superior genial tubercles actually provide attachment to the genioglossus muscle, and the inferior ones provide attachment to the geniohyoid muscle. Alright, just like there was an oblique line externally running behind, or rather below, the mental foramen, there is an oblique line in the internal surface as well, which is running from the inferior side of the internal aspect of the symphysis menti towards the posterior aspect, encroaching around the third molar tooth. So this is the oblique line that I'm talking about. Alright, so this oblique line, this is known as the myelohyoid line. Alright, so this myelohyoid line is pretty important because this will divide the internal surface of the symphysis or internal surface of the body of the mandible into two parts. The upper fossa, which is the sublingual fossa, which is smooth, and the lower concave submandibular fossa. Now obviously, as the name suggests, the smooth sublingual fossa will lodge the sublingual gland, whereas the concave submandibular fossa will lodge the superficial aspect of the submandibular gland. Alright, alright. Now let's talk about another aspect of the body. So I had said that the buccinator, that actually encroaches along the posterior part of the third molar tooth like this. Here it will meet what we say to be the pterygomandibular raphe. From the internal aspect, there is a muscle which also encroaches around the pterygomandibular raphe. That is known as the superior constrictor of the pharynx. The superior pharyngeal constrictor, that also encroaches around the internal aspect and will meet the pterygomandibular raphe along with the externally approaching buccinator muscle. Alright, alright. Now, apart from the myelohyoid line which we just talked about, there is another groove which is known as the myelohead groove. It is actually present in the posterior aspect of the somewhat ramus of the mandible actually, but we are talking about it here because we are talking about the internal aspect of the mandible. So this is the myelohead groove. Myelohead groove, as we can say, it is running from the posterior aspect towards the submandibular fossa's posterior aspect over here, like this. And this myelohead groove will actually lodge the myelohyoid nerve and vessels. Alright? Alright. Now, let's talk about some of the relations of the nerves and vessels as far as the internal aspect of the mandible is concerned. So the very first thing that we will talk about is the lingual nerve. So remember that I had said that the oblique myelohyoid line, that is actually encroaching like this, right? It is actually going like this from here to here, like this, right? So the part above the myelohyoid line, or the part above the posterior part of the myelohyoid line, in behind the third molar tooth. So the part that I'm talking about here is this part, that is between the third molar tooth and the posterior part of the myelohyoid line. This part of the inner aspect of the mandible is related to the lingual nerve. So this is the relation of the lingual nerve. Done. Now we had talked about the facial artery, vein, and the marginal mandibular nerve in the external features, right? So let's talk about some of the other relations as far as the facial artery is concerned. So see, I talked about the myelohyoid groove over here, right? So the facial artery, the tortuous facial artery, it has a loop which is related to the inner aspect of the mandible to somewhat over here. Alright, somewhat over here. So it is below the myelohyoid line on the posterior aspect, below the myelohyoid line, right? Somewhat over here, there is the loop of facial artery which will then go like this, and then we see it on the anterior aspect along with the other vessels and nerve, right? So that's the facial artery accounted for. Now, having somewhat talked about the internal features of the body of the mandible, let's finally talk about the borders of the mandible. So there's not much to talk about the upper or the alveolar border. It bears the dentation along with the maxilla, which bears the upper set of teeth, right? So nothing much to talk about this. But the lower border has some things going on for it. What are they? First is the presence of these two fossa at the midline level, right? These are what we say to be the digastric fossa, and they are two in number on each side of the, I would say, midline. These are the digastric fossa. They serve as the site of attachment for the anterior belly of the digastric, or rather I would say that they provide origin to the anterior belly of the digastric muscle. Alright, so these are the digastric fossa. Now overall I would say that the base of the mandible actually provides attachment to some structures. What are they? Firstly, we say that the platysma muscle is actually inserted onto the lower border of the mandible, right? Below, or rather behind the platysma insertion, we say that the deep layer of the investing layer of the deep cervical fascia, that actually gets attached to the lower border of the mandible. Alright, so the deeper layer, so the superficial and deep layer, actually what happens, I will tell you. The investing layer of deep cervical fascia, that actually splits into two parts, the superficial part and the deep part, for enclosing the submandibular gland. The superficial part of that deep cervical fascia gets attached along the myelohyoid line, whereas the deep part gets attached onto the lower border of the mandible, or the base of the mandible, behind the platysma. Alright, so that is also a very, very interesting attachment. Okay, So having talked about the borders of the body, let's now move on to the rami of the mandible. So each ramus, as we already mentioned, they are quadrilateral structures with two processes going out for them. The anterior one, this is known as the coronoid process, and it is triangular, as we can see. The posterior one has a little more characteristic shape, and as we can see, it is elliptical as far as its head is concerned, with a constricted neck. This is known as the condylar process. Alright, this is the condylar process. So coronoid process and the condylar process separated by a notch which is known as the mandibular notch. So the rami of the mandible, they also have these external surfaces, or known as the lateral surfaces, and these internal surfaces, or the medial surfaces, along with the corresponding borders that I just talked about. So as far as the lateral surface is concerned, this is flat, and it is mostly reserved for attachment of the masseteric muscle, or the masseter muscle, not masseteric, masseter muscle. Alright. However, there is an exception to this, that is posterior-superior part of the lateral surface of the ramus of the mandible is reserved for parotid gland and not for masseter attachment. Alright. Now as far as the medial surface is concerned, medial surface is far more interesting than the lateral surface. Why? Because as we can see, near its center, the medial surface is providing a foramen, which is the mandibular foramen. This mandibular foramen, this is actually transmitting the inferior alveolar nerve and vessels. Now, this foramen will lead downwards and forwards within the body of the mandible into what we say to be the mandibular canal, and then what will happen is, inside the mandibular canal, the inferior alveolar nerve and vessels, they will provide buccal branches and dental branches, right, to the lower set of teeth. And finally, what will happen is, they will divide into the mental nerve and vessels, and they will also divide into the incisive nerve and vessels. The mental nerve and vessels will come out, they will curve up and will come out of the body through the mental foramen, whereas the incisive nerve and vessels, they will not come out of the mandible, rather they will stay in and they will supply the incisive or the incisors, right? They will supply the teeth and the corresponding areas. So that's how this entire thing is going on. Now, a very interesting thing to notice here is that this mandibular foramen, this is actually, as you can see, guarded antero-inferiorly by this tongue-like process. This tongue-like process, this is known as the lingula. Lingula is pretty important because this serves as the point of attachment for a ligament which is known as the sphenomandibular ligament. Alright, so it is pretty important. Now, as I had said, this is the myelohead groove. So behind the myelohead groove, the part of the ramus of mandible, medial surface the medial surface obviously, this will actually provide attachment to the medial pterygoid muscle. Alright, so this is also a pretty interesting thing to note. Now, let's quickly talk about the borders and surfaces, right? So this is the mandibular notch, this is the condylar process, this is the coronoid process. Coronoid process, the apex of the coronoid process along with the subsequent areas, they actually provide attachment to the temporalis muscle. So actually what is thought of is that this coronoid process is formed in the first place by the upward traction of the temporalis muscle. Now, as far as the mandibular notch is concerned, the mandibular notch is there for transmitting the masseteric nerve and vessels. So the masseteric nerve and vessels, they are actually transmitted from the medial aspect towards the lateral aspect. Alright, because the masseter is over here. Now, another interesting relation I would say is that this is the condylar process, right? So this is the neck region of the condylar process, that is a constricted neck region. This neck region of the condylar process is actually related to the auriculotemporal nerve. Okay, it is related to the auriculotemporal nerve. Another interesting thing to note will be that below, or rather above and behind this mandibular foramen, this is the mandibular foramen, if you can see this, above and behind the mandibular foramen, this part of the medial surface, this is actually related to the first part of the maxillary artery. Alright, so the first part of maxillary artery relation is above and behind, this is the mandibular foramen. Let's talk about the processes themselves. So the condylar process, as I already mentioned, it is elliptical in shape and it is also convex in all directions. So what the condylar process is doing is, it is serving as a site of attachment for the fibrocartilage of the temporomandibular joint. Alright, because this is the condylar process is the process by which the mandible is articulating with the anterior part of the mandibular fossa of temporal bone, forming the temporomandibular joint. Alright, now the fibrocartilage, that is actually separated from the actual temporal bone by an articular disc. Alright, so that is also a feature of the temporomandibular joint. Another interesting thing to note about the condylar process is the presence of this depression over here. This depression on the condylar process in the neck region, this is actually the point of attachment of the lateral pterygoid muscle. Okay, and as I've already mentioned, the neck is related to the auriculotemporal nerve. Okay, coronoid process, on the other hand, as I've already mentioned, it is serving as the site of attachment of the temporalis muscle. Done. Now, another interesting thing to note here is the presence of this very characteristic angle of mandible. The angle of mandible is formed in between the posterior border and the lower border of the rami of the mandible on both sides. This angle, characteristically in adults, it is about 110 to 125 degrees. But in case of younger children or in case of old people, this angle will increase drastically to about 140 degrees, right? So this will actually serve as one of the identification features for the age of the mandible. Also, the angle is serving as a site of attachment for the stylomandibular ligament. Alright, now there are a few important age changes that happens in the mandible, which makes mandible a very important bone as far as the age determination is concerned. The first change is the presence of this mental foramen. So depending on the position of the mental foramen on the border, or rather on the body of the mandible, we can actually kind of determine the age of the mandible. So if the mandibular or rather the mental foramen is located somewhat midway in between the alveolar and the lower border, we say that the person is an adult. However, if it is located more towards the base, then we will say that it is more younger a mandible, right? However, with age, the mandibular or rather the mental foramen, not the mandibular foramen, the mental foramen, this with age actually rises above, because there is consequently erosion, right? With consequent erosion, it actually rises above, and the more it rises, the more we can say that age has passed. So in old people, this mental foramen is more proximal to the alveolar border, whereas the younger the person, the closer the mental foramen to the base. Another very interesting thing to note will be the level of the condylar and coronoid processes. In adults, they are nearly of the same height. However, in children, this coronoid process is longer, whereas the more the age passes, the condylar starts lengthening and the coronoid starts shortening. So in older people, we say that the condylar is at a higher level than the coronoid process. Alright, so this is more or less the changes that are occurring for old age in the mandible, which help us in determining the really important aspects as far as the age of the mandible is concerned. So with this, we actually end the entire mandible, more or less, I guess. I hope this helped you, and I hope this wasn't too fast, or I hope I also didn't miss anything. I have to go and check now. So thank you very much for watching, and yeah, stay tuned for more rapid recall videos. Thank you.